I'm Aung. I'm a civil rights lawyer and writer based out of New York City, and I'm originally from Myanmar. For the last couple of years, I've been working with Burmese activists from Myanmar and abroad to promote a more inclusive and tolerant Myanmar national identity and to push for equality for Rohingya Muslims and other ethnic and religious minorities. Today, I'm going to talk about COVID-19's impact on civil rights in Myanmar, and in particular, how it stoked repression of vulnerable populations, especially ethnic and religious minorities, and hampered their access to healthcare and reliable public health information. During the pandemic, reports have surfaced that social distancing measures have been disproportionately and unfairly enforced against religious minorities, and that the pandemic has been used as cover to further oppress ethnic minorities. That ongoing civil rights suppression that has nothing to do with COVID, as well as measures to quell ethnic unrest, have hampered minorities' ability to take health and safety precautions. All of this is particularly alarming to me, as my home of New York City is the global epicenter of COVID. Despite the pandemic, we had protests across the United States after the police killing of George Floyd, a black man, and some of these protests were repressed with force, night curfews, and other civil rights curtailment. In Myanmar, there's been strict measures to address COVID, even though it went into lockdown on the late side in early April. Actual COVID case counts are uncertain, though low by official counts at approximately 261 cases and 6 deaths as of today's taping on June 14th. There was a mandatory 28-day quarantine for arrivals from foreign countries, a ban on gatherings of more than 5 people, and night curfews. The failure to report a COVID case is a criminal offense, and authorities can prevent infectious people from leaving their homes and impose regional movement controls with financial fines and even jail. Some have raised concerns about unequal enforcement of social distancing policies and public health measures in Myanmar. Reports say that large Buddhist gatherings have been allowed, but those of religious minorities were broken up and participants arrested. Reports also suggest that the few remaining Rohingya in the country and other religious minorities are subjected to arbitrary and harsh punishment for violating social distancing. Scores of religious minorities, as well as migrant workers returning from other countries, have been quarantined or jailed under overcrowded and really unsafe conditions. I also want to talk about a particular case that's demonstrative of broader, ongoing religious oppression and censorship in Myanmar, as well as how this pre-existing problem has gotten in the way of an effective COVID response. Artists in Khin State put up a mural in Myanmar with a flag that read, "Stay at home, save lives, we fight together." To any reasonable person, this was an attempt to promote national unity in the fight against COVID. But Buddhist extremists argued that the mural's depiction of death looked like a Buddhist monk. The painters were charged under a penal code provision criminalizing speech insulting religion, which has up to 2 years jail time. Now, this is part of an ongoing pattern in Myanmar, separate and apart from the pandemic, to censor frank and open discussion about religion, which in this case had the unfortunate effect of hampering COVID public health outreach. Also, measures to stem civil unrest and squash ethnic rebellions have prevented the ability of ethnic minority communities to address the threat of COVID. The country has had internet shutdowns in ethnic minority areas like Rakhine and Khin states, which have experienced civil unrest. The articulated purpose of these shutdowns is public safety and security, but they've also made it difficult for citizens to access public health information about COVID. In Rakhine, the Burmese military has stepped up its efforts during the pandemic to crack down on Buddhist Rakhine seeking autonomy, including civilians and politicians. The military has also put in place roadblocks to gain control of areas in Rakhine, which has made it harder for civilians to get to hospitals. Rohingya and other minorities actually displaced from their homes in Myanmar have been impacted by COVID in distinct ways as well. Malaysia has turned away or detained boats of Rohingya refugees due to fear of COVID, and refugees in overcrowded Bangladeshi camps and also those displaced on the Myanmar-Thai border have difficulty social distancing from each other, as well as getting personal protective equipment and sanitation supplies. I should note that for what it's worth, the Myanmar government did announce a joint COVID-19 subcommittee with armed ethnic groups to curb COVID and to share public health information. That said, it's really unclear whether this has had any impact whatsoever, and especially in Rakhine State, which is currently one of the most active ethnic rebellions. What we see here, sadly, is that Myanmar's COVID response, which has been late and somewhat inept, has been even more hampered by pre-existing civil rights violations and repression. Even worse, the military has actively used the emergency conditions created by the pandemic as cover to crack down even more on religious and ethnic minorities. In the United States, where I live, the George Floyd killing has ignited a broader public awareness and commitment to take on the issue of racial inequity that's greater than any that I've ever seen in my life, even though we're still a long way where we need to be. And similarly, those of us concerned with civil rights in Myanmar need to take this moment to expose the injustice of how COVID has been leveraged by Myanmar to step up ongoing repression of ethnic and religious minorities, and how this has not only oppressed those minorities' civil rights, but also hampered their ability to take public health measures to protect themselves from COVID. Thank you.